Hey, I'm Dr. Nick Scotto with River City Physical Therapy, located right here in the heart of Jacksonville. And today I want to talk to you about insertional Achilles tendinopathy. Now there's two different types of Achilles tendinopathy. There's the type where you feel pain in the middle of your Achilles tendon, right where that thick band is as you trace from your calf down to your heel. There's like a thick band that you feel there, your Achilles tendon. You can have pain there, which is your mid-portion Achilles tendinopathy, or you can have pain right where the Achilles inserts or attaches into the back of the heel bone. So if you have pain right in the bottom back of your heel bone, it may be caused by insertional Achilles tendinopathy. Some of the symptoms include pain in the back of the heel when you're just walking around. When you're walking and you kind of flex your foot upward, you may feel kind of like a pinch or pain in the back there. Usually females who have this, especially female runners, have relief when they are wearing high heels as opposed to wearing flats. And that's because with high heels, their foot is pointed downward and it's not putting so much stress placed on the back of the heel there. It's commonly seen in runners, especially more competitive runners who usually run 5Ks, half marathons, even marathons on a regular basis. And again, it's felt in the back of the heel. Now, some of the mistakes that people have or make when they have this kind of disorder is that they try to stretch it out as if it's a normal Achilles tendonitis or a normal Achilles tendinopathy. But what happens when you do kind of like that wall stretch where you stretch the calf, or maybe you hang your heels off an edge and kind of stretch your calf that way, what that does to this specific disorder is it pinches the part of the tendon that's getting irritated. So your pain will get irritated. It will keep on coming back if you stretch it out. It doesn't like stretching. It doesn't like being compressed. And they found that through the research, if you have this condition and you start out by stretching, the pain will persist or maybe even get worse. And that's a common mistake that people make. Now, what causes this? Typically, it's caused by overuse of that tendon in that area. So there might be other factors that play a role as well. Some lack of ankle flexibility, lack of strength in the lower leg, or maybe even a problem in the pelvis and hip strength as well. So those issues need to be addressed in order for this to go away. So if you have this and you've been stretching it out, you need to just stop stretching, see how it responds. You also may need to change the way that you walk. You may need to walk more with less of a flexed foot up when you go to step forward. Try not to flex your foot upward too much because that'll cause too much pain in that area. You may benefit from a small heel lift in the back of your shoe. So if you put a little heel lift up, it'll make your foot kind of point down a little bit, which is good for the tendon. It takes the pressure off the tendon. To successfully treat this, you want to do a progressive loading program. So you want to work the tendon and do certain exercises that help it get used to being able to tolerate load, and then progressively move upward in more exercises so that the tendon can do its job when you're running or when you're walking or maybe even when you're doing your typical exercises. So if you've had symptoms like this, or maybe you've gone through treatment and it's failed, give us a call at 904-566-7070 and we'll be happy to talk to you about this specific diagnosis and what it takes for you to get back to running pain-free, exercising pain-free, or even just walking pain-free. Hope to hear from you soon.